Hello all, I'm Dr. Mohit Arora, consultant orthopedics. Today I'll be talking about knee joint osteoarthritis. Knee joint is made up of three bones, namely femur, tibia and patella, which together form three joints in the knee, namely medial tibiofemoral joint, lateral tibiofemoral joint and patellofemoral joint. So knee osteoarthritis is basically a degenerative disease of the knee joint. So this is a knee joint model, the femur, tibia and fibula. Now you can see the covering of the femur articular surface. This is the cartilage. Then there are certain structures in the knee. These are medial meniscus, lateral meniscus, anterior cruciate ligament. Then on the outer side is lateral collateral ligament, and on the inner side is medial collateral ligament. On the back side there is posterior cruciate ligament. So all of them play important role in the proper functioning of the knee joint. Now in case of knee osteoarthritis, the articular cartilage starts showing degeneration. Now I will show you another model which has got moderate osteoarthritis. You can see the cartilage starts cracking. Now in case of severe osteoarthritis, the cartilage, there is a complete loss of the cartilage, so much so that on X-ray it appears that the bone, the femur bone, is sitting on the tibia bone. Basically, there is a decrease in the joint space. I see a lot of patients in my OPD daily of knee osteoarthritis. They usually complain of pain in the knee joint, especially on the inner side, which increases on walking and relieves on rest. The pain increases on climbing stairs. Sometimes they also have swelling in the knee joint, and there might be stiffness and restrictions of the range of motion of knee joint. Let's talk about the risk factor that predisposes to knee osteoarthritis. They are divided into two types. Number one is non-modifiable, meaning which cannot be modified. These include female gender, increasing age, and sometimes genetic predisposition. Then the other category includes modifiable factor. In those patients, they usually have obesity, diabetes, and which predisposes them to knee osteoarthritis. Sometimes there is a history of trauma to the knee joint, either in the form of bony fracture or some cartilage damage, or meniscus injury or ligament injury. This also predisposes them to knee osteoarthritis. Then sometimes the patient has muscle weakness around the knee joint, namely quadriceps, and this also predisposes them to knee osteoarthritis. Coming over to the pathophysiology of the knee osteoarthritis, the pathological changes occurs in three areas. Number one, cartilage. There will be increased water retention. Then there will be loss of collagen in the cartilage. Then in synovium, there will be hypertrophy of the synovium, and in later stages, in case of severe osteoarthritis, the synovium become hypervascular. That means the blood supply of the synovium increases, leading to joint effusion and pain. Then the third is bony changes. Bony changes are usually in the form of subchondral sclerosis. Coming over to the treatment of osteoarthritis, which is the most important part. Now the treatment consists of a holistic approach. That means we not only give the medicines to the patient, we also advise them lifestyle modification. So the number one is exercise. We tell the patient to strengthen their quadriceps muscles and do knee bending exercises. If the patient is overweight, then we tell them to reduce the weight. Then if they have got any other comorbidities like diabetes, thyroid, we tell them to take treatment for the same. Then sometimes we ask them to take stick in the opposite side if there is a problem with walking. Then we tell them to avoid squatting or sitting on the floor. Then there are certain medications which we give them. Since knee osteoarthritis occurs in older age group, we usually avoid non-steroidal anti-inflammatory drug. We give analgesics in the form of opioids. Then we give them local gel or ointment, and we advise them hot or cold fermentation depending upon the clinical scenario. Then there is another type of treatment, viscosupplementation, in which we inject a substance into the knee joint which leads to improved lubrication of the knee joint. Then there are certain drugs which are available like glucosamine sulfate and chondroitin sulfate. They basically are present naturally in our body. They play a role in slowing cartilage degeneration. Then there are another group of drugs like type 2 collagen, which has shown promising results lately in preventing cartilage degeneration. These interventions are usually effective in early stages of osteoarthritis, and if the patient presents to us in the later stage of osteoarthritis like severe or grade 4 osteoarthritis, then we advise them to go for total knee replacement.